What is a brain aneurysm? A brain aneurysm is a weak spot in the wall of a blood vessel inside the brain that can sometimes burst and cause a subarachnoid hemorrhage or SAH. Think of a weak spot in a balloon and how it feels stretched out and thin. A brain aneurysm is like that. That area of a blood vessels get worn out from constant flow of blood and bulge out almost like a bubble. It can grow to the size of a small berry. There are different types. Secular aneurysm are the most common type of brain aneurysm. They bulk at brain aneurysm symptoms. The type of symptoms you have from a brain aneurysm depend on whether it's ruptured or not. Intense headache that comes on suddenly, loss of consciousness, nausea and vomiting, drowsiness, loss of balance in things like walking and normal coordination, stiff neck, delayed pupils, sensitivity to light, sudden blurred or double vision, dropping eyelid, confusion or trouble with mental awareness, seizure. Although brain aneurysm usually don't show symptoms, they can press on the brain and nerves as they get bigger. Unruptured brain aneurysm. See a doctor at once if you're having a new headache or pain above or behind your eye. Call 911. Other symptoms of an unruptured aneurysm are delayed pupils, blurred and double vision, dropping eyelid, a hard time speaking, weakness and numbness in one side of your face. A suddenly intense headache can also be sign you have a leaking aneurysm. Central bleed. This can be a warning sign. You will soon have a full rupture. Brain aneurysm causes. Brain aneurysm usually develop as people age, becoming more common after 40. It's also possible to have a blood vessels defect at birth. Women tends to have higher rates of aneurysm than men. Aneurysm tends to form at the fork blood vessel, places where the branch off because those section tends to be weaker. They are most commonly found at the base of the broad cause of brain aneurysm to rupture. If your brain aneurysm rupture or leak and causes a hemorrhagic stroke, you'll need medical treatment right away. This is a rare but can be life-threatening. Your doctor usually won't know why your brain aneurysm ruptured, but experts know a few reasons could heighten your risk of bleeding. High blood pressure. This is the most common factor that leads to a ruptured brain aneurysm. Heavy lifting or straightening. Your brain aneurysm may rupture because of pressure from lifting or straightening. Strong emotions. If you're very upset or angry, this is the risk your blood pressure lead to rupture aneurysm. Medication. Blood thinners including warfarin, comodine, gentabin, and other medicine or prescription drugs such as diet pills like epidural and amphetamine can cause aneurysm is bleed. Illegal drugs harmful like cocaine can cause your aneurysm to rupture. Brain aneurysm harmful risk factor. Smoking and high blood pressure are the things that put you in the most risk of heavy brain aneurysm. But several other things in your medical history and the lifestyle also increase your odds. Medical history. Brain aneurysm complication. A ruptured brain aneurysm can be a life-threatening and lead to cerebral vasospasm, reduced blood flow to the brain, hydrocephalus, too much spinal fluid in the brain, coma, permanent brain damage, with bleeding again, hyponatremia, low sodium in your blood. Brain aneurysm prevention. Once your doctor finds an aneurysm, it's very unlikely that it heals on its own. The good news is you can take steps to stop it from growing or leaking. There are also things you can do to lower the risk of a new aneurysm. Stop smoking, eat a balanced diet, work out regularly, and avoid constant heavy lifting. Stick with moderate exercise. Don't use cocaine or other stimulant drugs. Get help for any alcohol or drugs problem. Keep your high blood pressure in control in medicine lifestyle changes. What is the outlook with the brain aneurysm? You may never know that you have a ruptured brain aneurysm. If it doesn't rupture, you may live your entire life without any issues. But there's always a risk that it'll bleed. If this happens, you'll need immediate medical help. The longer you wait, the worse your outcome could be. You change your death or disability go up as more time passes after your aneurysm rupture. Around 75% of people with rupture brain aneurysm will live longer than 24 hours, but a fourth of these people could be fatal complication within the next 6 months. If your doctor doesn't treat your aneurysm quickly enough, you might bleed again from the same area. So it is important to get help as soon as possible if you think you have a symptoms brain aneurysm.